Hi everyone, I want to talk about post-flu asthenia. Asthenia simply means lack of energy or there's weakness for weeks or months. This is also referred to as post-flu fatigue. Can be after any viral infection. In other words, it doesn't have to be flu or influenza A or B infection. It could be after Epstein-Barr viral infection, herpes, or even HIV. The pathogenesis is that it's likely due to the presence of pro-inflammatory cytokines, and sometimes it could be as a result of hidden viruses. The possible causes are influenza A, influenza B, that is flu, or HIV, though somebody will say you said post-infection, then doesn't mean after HIV is cured. No. Infectious mononucleosis, German measles, that is rubella, or rubeola, the measles, and of course herpes virus. Possible symptoms are tiredness. The individual will be complaining of tiredness, even work absenteeism. Please, you may find it difficult to believe these people when they absent themselves from work, but just believe that it's possible. Decreased level of consciousness, impaired memory, headache, joint pains, the lymph nodes will still remain enlarged, pharyngitis, muscle pain, depression, hypersomnia or insomnia. How do we make diagnosis of post-flu or post-viral asthenia? There's no specific diagnostic tools, but we can rule out differential diagnosis. And in that case, we'll work on what could be the causes of the weakness or the fatigue. And you can rule out situations like chronic fatigue syndrome, anemia, decreased glucose, that is hypoglycemia, hypothyroidism, depression, medications, narcolepsy, seizure disorder, heart failure, or toxins. Depending on how the history will lead us, that would determine the type of investigations we're going to carry out. For example, if it's pointing to hypothyroidism, I'll do what is called thyroid function test. In that case, I would like to know what the thyroid stimulating hormone level is, the level of T3 and T4, and possibly antibodies in case of Hashimoto's thyroiditis. History will determine the laboratory or radiological test, like I've just said. The treatment will depend on the identifiable conditions. So there is no clear-cut treatment for post-viral asthenia. The treatment is whatever will pick on the history and the subsequent laboratory or radiological investigations. So kindly subscribe to my channel so that you can get my presentations immediately they are published. Thank you.